The Norman Saunders Complex Care Initiative is revolutionizing how medically fragile children are being treated in Canada. The service at Sick Kids Hospital provides a central location for all healthcare support and active collaboration with family members. Since 2006, it has opened its doors to children with multiple and complex health challenges, oftentimes who could not find adequate care anywhere else. For Ian Brown's 19-year-old son Walker, who is diagnosed with a rare genetic disorder at birth, the care provided more than just resources to manage his health. It was the first time his son was not just treated as a patient or a problem to be fixed, but as a human being.
I think one of the reasons why the Complex Care Initiative came about was partly because of Walker and other kids like him. His pediatrician was a guy named Norman Saunders, and Saunders was the guy who initiated the complex care.
Dr. Saunders was the first to diagnose Walker with cardiofasciocutaneous syndrome, a rare disease characterized by heart problems, distinctive facial features, and skin abnormalities.
I think there are 150 identified cases since they've been doing the gene test, and about 300 cases that they suspect are CSC, but they haven't actually located the specific gene.
Dr. Daneman from Sick Kids, who now runs the initiative, says that although not many kids need complex care, those who do require many resources.
2.9% of patients account for 18.8% of all admissions and 23.2% of all inpatient charges. So a small group of patients are disproportionately more frequently admitted to hospital than others. They require more complicated services, and they require them repeatedly.
Like many medically fragile children, Walker can't speak and has intellectual disabilities. His father says that the frequent trips to different hospitals and doctors took its toll.
Some weeks we were probably in the hospital 4 and 5 times a week. You know, if you go into emergency, you sit in emergency with a bunch of kids, and there's a bunch of toys on the floor, and there's a TV in there. But Walker doesn't watch the TV, and he doesn't play with toys. So, and although I think he probably is aware of his differences, so that could be pretty upsetting time. And if you're waiting for 2 hours or 3 hours or 4 hours, and you're waiting 4 times a week, that's 16 hours of uninterrupted agony. And you could take him to the doctor's office, but Dr. Saunders was a brilliant pediatrician, and in fact the guy who diagnosed CSC.
Dr. Daneman says that Dr. Saunders had a vision for complex care.
The view was in a number of places about the same time in the late 90s or early 2000s that if we set up an initiative that provided all the services they needed in one place instead of seeing multiple specialists, and they saw as few healthcare professionals as possible so that they could anchor on one physician or 2 physicians rather than 12 physicians. And if we set in motion stuff that would help them go from hospital to home and keep them in the home, and also help the local community hospital look after them more appropriately, we would save these kids hospital admissions, we would save them frequent visits to the hospital, we would save them more rapid deterioration. And all those things have turned out to be true.
Not only were these resources now centrally available, but the way in which care was delivered contrasted Ian Brown's previous experiences.
Well, nobody really knows anything about it. So, there were 8 known cases, right? So we certainly didn't know what we were doing, and the doctors, we gradually discovered, didn't know either. We thought for a while they did, and that's why they were behaving in such definitive ways. But, after a while, we could tell as well as they could whether what they were going to prescribe was going to work or not. So, we'd say, that's not going to work. It's not his ears. It's not his ears. He doesn't cry like this when it's his ears. And, then they prescribe something and it wouldn't work. And we come back a day or 2 later and say, I told you it wasn't his ears. And they go, okay, maybe it's something else. Maybe it's his skin. Maybe it's anxiety. But nobody knew because he couldn't speak, and therefore you couldn't tell, what was causing him pain. And quite a bit seemed to.
The quality of care that was provided by the Complex Care Initiative allowed for an improved doctor-patient relationship.
The one thing that's quite important from the family standpoint is the more severe the complex disease is, more likely will this put stress on the family, both emotional stress, financial stress, and the families are more likely to fragment, to not keep up, and there's a need to make sure that there are programs that support them in that. It's important for the physicians that see them to be knowledgeable about their child so that they don't have to sit around waiting for somebody to get the old chart and spend 5 hours looking through it before they see the child. Sensitive to some of the behavioral issues that may go along with their child in the hospital, make sure that they can navigate the system well.
Rather than a black and white approach to healthcare, Ian Brown says that the Complex Care Initiative has provided a more nuanced way to help Walker and other kids.
Now that we know at least that there is this need for complex care, how do you approach it? Well, I think you approach it as a collaborative project where everybody's speculating as much as they are reading data. And not to say that data is not important, but these are very hard things to measure. They're real things. Well, you can't fix them, right? And they keep coming back. You can't fix them, and they keep coming back, and you have to develop a system of care that recognizes that.
For Evidence Network, this is Dane Wanyarachige.